I'm going to check my physician's orders, and I see that we have an order for 40 milligrams of furosemide in 4 milliliters. So I'm going to check the compatibility with any other IV medications, and that would be if they were having an infusion, but our patient is not going to be having an infusion. I'll also note that 40 milligrams of furosemide should be given over 1 to 2 minutes. I'm then going to make sure that I have all the appropriate equipment, that it is in date, and that it is not contaminated. I'm going to perform hand hygiene and draw up my medication, remembering the rights to medication, right time, right route, right dose, right medication, right patient, right documentation, and right indication. And then draw up 4 milliliters of furosemide. And I'm then going to Catlin medication. And I'll then label my syringe with furosemide 4 milligrams and 4 milliliters, and I'll also initial and put the date and time that I drew up the medication. I'm then going to go to the patient's room. I'll knock. Hi, my name is Maddie. I'm going to be your student nurse today, and I'm going to be giving you your IV medications. I'm going to provide the patient with privacy. Can you state your name and date of birth for me? Patient states their name and date of birth. And I will then explain to them the procedure, that I'm going to be giving them their IV medications and letting them know to let me know if they have any discomfort at the site of their IV, or if they are having any dizziness or nausea when I'm injecting the medication, so that we know that they aren't having any adverse reactions. I'm going to perform hand hygiene and maintain an aseptic technique. I'm going to assess the site for patency and any redness, edema, or warmth. I would clamp off any other IVs that they have going, making sure that our IV is unclamped, and I will uncap the ENT using an alcohol swab. I will then clean the rim and the tip of the ENT. I'm then going to connect my normal saline, and I'm going to aspirate and then flush and prep the line. I'm then going to begin giving the medication, noting that it will have to be given over a 1 to 2 minute time period. So I will be using the push-pause method. So I will push and then pause and inject the 40 milligrams over a 1 to 2 minute time period. I will then flush the line again using the push-pause technique to flush it after as well, in case there's any medication left in the tube. So then I will push and pause, and I will do that over a 1 to 2 minute time period as well. I'm then going to recap the INT and clamp our tube. will then adjust the flow rate of the infusion if necessary, but again, our patient is not having an infusion. I will then dispose of my syringes appropriately and also dispose of anything else that I have left here. And I will again make sure that the patient isn't having any adverse reaction to the medication, and then I will document appropriately.